Now let's take a look at some disorders of the blood. We're going to start with some erythrocyte disorders. So these are disorders of the red blood cells. We'll start with polycythemia. This is where you have too many red blood cells. It can be caused by a few different reasons, which we'll talk about in just a second. But we can also have anemia as a disorder of the red blood cells. This is where you either don't have enough red blood cells or you don't have enough hemoglobin in those red blood cells, and so that inhibits your ability to be able to carry and transport oxygen throughout the body. So people who are severely anemic sometimes have trouble getting oxygen to their cells. There are several different causes for anemia. The three main causes are going to be a reduction in the production of erythrocytes, destruction of those red blood cells or breakdown of those red blood cells at a higher rate than you are able to replace them, or hemorrhage, which is just a massive bleeding disorder. So looking at the reduction of the production of red blood cells, this could happen for a few different reasons. You could have what's called iron deficiency anemia, where you don't have enough iron in your diet. If you're not getting enough iron in your diet, you don't have that precursor for those heme molecules that are present in hemoglobin, and thus you're not going to be able to produce as much hemoglobin or as many red blood cells as you should be able to. With pernicious anemia, this is an autoimmune disorder that damages the stomach, preventing the stomach from being able to produce something called intrinsic factor. Now, intrinsic factor is necessary for us to be able to absorb vitamin B12 from our diet. If we don't have any intrinsic factor, we cannot absorb that vitamin B12, and vitamin B12 is necessary for us to be able to produce red blood cells. If you have gastric bypass surgery, sometimes that can affect the production of this intrinsic factor as well because it damages the stomach. We also know that any types of chemotherapy, radiation, certain types of viruses, that they can damage bone marrow, which can damage the production of red blood cells as well. Kidney disease can also cause a reduction in red blood cells because if your kidneys are damaged, they're not going to be able to produce the hormone erythropoietin as well, and that is the major hormone that stimulates the production of red blood cells in the bone marrow. Without that erythropoietin, you don't have any stimulus to tell the bone marrow when it's time to make new or more red blood cells. We could also see anemia if red blood cells are destroyed at a faster rate than they are made, such as hemolytic anemia. This is where the red blood cells are lysed or broken down faster than they can be remade. This could be caused by different types of infections, disease, certain types of reactions to certain types of medications or poisons. Hemolysis can also happen whenever you are bitten by certain types of snakes. They have hemolytic toxins in their venom that could cause hemolytic or hemolysis as well, and so that could lead to forms of hemolytic anemia. Hemorrhaging can cause anemia. This is obviously just where you lose blood. So if you're losing blood due to some kind of traumatic event, or even in women, if you have a very heavy menstruation, that can cause you to lose a lot of excess blood, and that can lead to a loss of red blood cells that you are not able to replace quickly enough. And we know that this can lead to hypoxia. If you're not having enough red blood cells, you're going to have a low oxygen level in your tissues. Polycythemia is another disorder of the red blood cells, but this is where you have too many red blood cells, and this could be caused by a variety of reasons. You can have polycythemia if you live in very high altitudes, because at high altitudes there's less oxygen available, and so your body tries to compensate for that by producing extra red blood cells to give you, more availability to transport more oxygen through the body. You could also develop polycythemia if you are extremely dehydrated, because at that point you're not going to have as much water in your bloodstream, so the red blood cells are going to be way more concentrated in the blood. It's going to cause the blood to be more viscous and a lot thicker, which means it's not going to be able to, move around through those vessels as well as it once did. Polycythemia can also be caused by cancer of the bone marrow, where you are just producing too many red blood cells because those cells are cancerous and they're just dividing at a very rapid rate. Now, polycythemia in very small doses could be beneficial, so you'll see athletes sometimes they'll go practice at high altitudes to try to stimulate the production of more red blood cells, because if you have a few extra red blood cells, it allows you to get more oxygen to your tissues and allows you to have a little bit better endurance. But if you produce too many of these red blood cells and the blood gets too viscous and too thick, it can cause problems with an increase in blood pressure, which is going to increase your risk for things like heart attacks or strokes. Now let's look at some disorders of the leukocytes. Leukopenia is the first we'll talk about. This is where you have too few white blood cells. You don't have enough of these. This could be caused by exposure to poisons, to cancer treatments like radiation or chemotherapy. If you're taking any kind of immunosuppressant medications for some reason, maybe you have an autoimmune disorder and you're on immunosuppressant medications, any of those cases could cause leukopenia, where it's going to decrease the number of white blood cells. Also, if you have HIV virus, that virus can damage certain types of white blood cells, especially the T cells of your body, and so that's going to decrease the number of white blood cells as well. Now, if you have leukopenia, if you don't have enough of these white blood cells, that's obviously going to inhibit you from being able to defend yourself against certain types of pathogens or diseases. So it's going to cause you to be very immunosuppressed. Leukocytosis is just the opposite. This is where you have too many white blood cells. So this could be caused by an infection. If you have like a bacterial infection, for instance, your white blood cells are going to divide during infection. They're going to replicate, make copies of themselves so that they can more effectively fight off that pathogen. And so you'll see leukocytosis in normal healthy individuals who have an infection. And you can observe this if you do a white blood cell count and look at their white blood cells. Typically, you will see neutrophils, especially the number of neutrophils will go up very drastically during bacterial infections because those cells are dividing again to fight off those bacteria. Leukemia is a cancer of the white blood cells, which causes your bone marrow to produce too many white blood cells. But these white blood cells are not going to necessarily be beneficial to you because a lot of times they are mutated and they're not going to be very effective at being able to fight off pathogens. So they're not going to be very useful white blood cells, and they're going to overcrowd some of the other cells in the blood, which is going to cause problems because if you're overcrowding the red blood cells, for instance, you're not going to be able to get enough oxygen to your tissues. So there are a few different types of leukemia. You have myeloid leukemia. This is where you're producing too many granulocytes. So those again are the neutrophils, the basophils, and eosinophils. Or you could have lymphoid leukemia, which is where you produce too many lymphocytes or monocytes. You could have acute leukemia. This would be very quick progression, very rapid onset. It comes on just all of a sudden and it progresses very, very quickly. This would be a very detrimental form of leukemia to have because you could end up dying very quickly, even within just a few months of developing acute onset leukemia. Chronic is a little bit different. That chronic leukemia is going to develop more slowly. You'll have a little bit more time to kind of treat yourself, treat the symptoms, go through chemotherapy and things like that to try to mitigate the disease and slow the progression down. So here's just an image of monocytic leukemia. This is where the body is producing too many monocytes, and you can see that there are a lot of monocytes in this picture, way more than there should be. Monocytes should be the least abundant white blood cell type in the body, and so the fact that there are this many on this slide indicates that that's a problem. Now we know that obviously bone marrow is going to be producing these white blood cells, and again, as I said before, typically these white blood cells in leukemia are going to be mutated in some way so that they are not going to function as well. They're not going to be able to fight off infection, which is going to increase your susceptibility to diseases. It's going to prevent you from being able to, fight off any type of pathogens that you might come in contact with. It's also going to cause a decrease in your red blood cell numbers, which is going to increase fatigue-like symptoms because you're not going to be getting enough oxygen to your tissues. It's also going to cause platelet deficiency because these leukocytes are overcrowding those platelets as well, and so that's going to decrease your ability to be able to form clots, and it's going to cause you to become more free bleeding, which kind of leads us to these clotting factor disorders. So these are typically disorders of either the platelets, which we know are going to be involved in helping to form blood clots, or other clotting factors like the clotting proteins that we've mentioned in the previous video. So hemophilia is one type of clotting disorder. This is a hereditary disorder where there is a lack of a certain protein in this clotting cascade, and so these individuals are not able to form blood clots at all, and that makes it very difficult for them to control bleeding. So people with hemophilia are typically called free bleeders because they will bleed a lot, even from just the simplest cut. Thrombosis is where you have unwanted clotting in a unbroken blood vessel. So we want to form clots in broken blood vessels. That's how we seal off the damage and prevent bleeding from that vessel, and then allow that vessel to have time to repair. But if you have an unbroken blood vessel, you do not want to form a clot because those clots could lodge themselves in the vessel and prevent blood flow to certain areas of the body. And if you're preventing blood flow to those areas, those tissues are not going to be able to get oxygen and nutrients. And so it's going to cause death or destruction to those tissues. So thrombosis can be dangerous, especially if that clot starts to form in vessels in very significant parts of the body, significant organs like the heart or the brain. Now, a thrombus is just a very large clot that may be large enough to obstruct a blood vessel, like I was mentioning before. And again, a thrombus is going to be really dangerous if it gets into the heart or the brain, because it's going to prevent blood flow to those areas, and it could cause death very quickly. An embolus is basically a freely floating thrombus or piece of a thrombus that breaks off of a blood clot, gets into the bloodstream, and then can flow through the blood and potentially block a different artery. This could lead to, again, a destruction of the tissue because the tissue is no longer going to be able to get oxygen. So again, embolus, this would also be very dangerous. If it were to lodge in the brain, it could cause a stroke. If it were to lodge in the carotid arteries, it could cause, the coronary arteries, it could cause a heart attack. So embolus is also dangerous. Thromboembolism, similar thing. This is where you have a traveling blood clot. The full clot kind of breaks off, starts to travel through the bloodstream. And again, if it lodges itself into any of those critical areas that I mentioned, it could cause death very quickly, because if you block off blood flow to the brain, the heart, pulmonary arteries even, it's going to be extremely dangerous and deadly. So let me know if you guys have any questions, and I will see you next time.